So good afternoon. Hi, I can see Lakshmi. Um, Hi, we'll wait for a couple of minutes and then maybe get started. So good afternoon. Welcome to our workshop today on World Heart Day. Okay, so let me start sharing my screen and we'll go ahead. Okay, so hi, I'm Dr. Prajakta from Healing Harmony Homeopathy Clinic. It is a homeopathy holistic clinic and we are situated in Malad West. And today on the occasion of World Heart Day, I'm going to help you all to give some information about the current scenario of the heart diseases. Okay. So Lakshmi, you are here. If you have any questions, maybe we can, discuss. I think we'll start and at the end of it, अगर आपको कुछ लगा तो you can talk to me. Okay. So the heart disease, okay, it's something which is very important and very concerning these days. Why? I'll tell you, because in my practice, suddenly in the last I would say 3-4 years, there have been deaths because of the cardiac diseases, too many. And to the surprise, it's not happening just as a old age entity. Okay, it is happening to young people. It is happening to people who are in their middle age, around 40 to 50, or maybe less than 40 also I have seen. And we thought that it's very important and very concerning uh, for everybody, to have these diseases. We heard news also, right? Somebody who was working in the gym and then he severely got heart attack. So that topic is becoming very concerning these days. So what we have noticed in the last few years is it's not just the old age that is causing you to give cardiovascular diseases, but it is the young people are also affecting. So how you can help your yourself or your children or maybe your siblings or any people around you, to get your heart at a balanced level. Okay. So if we understand, let's first understand a little bit about the heart, okay, and why heart health matters for the youth. It is the most important organ which gives oxygen and nutrients to the body, okay, and prevention is something which can be done if it is started at a proper age and proper care to be taken. Healthy habits and a changes in the lifestyle can help you to come out of it completely. So of course there is a factor where there is an hereditary, or if you have any family members who had heart diseases in the past, will of course have an increased risk for it, but definitely we can lengthen it, we can be better in our lifestyle, which can help us to get better heart health. And what we have observed these days is approximately 1 in 4 young adults, they will have high cholesterol levels. Okay. So what is the cholesterol? Cholesterol is the amount of the fat, okay, in the blood, in the common language, if I have to say, right? So why these cholesterol levels are important? Because the more cholesterol in your body, the more dense the blood becomes, and it can create the plaques or kind of a, it can thicken your arteries of the blood, and that can give you complaints related to the heart. Okay, and why it is more happening these days? Because of sedentary lifestyle. Most of us, including the children, we are seeing their screen time is increased. They are more playing inside the house or indoor games, and most of our work is now is on the computers, right? So the sedentary lifestyle and obesity, most of, at least in Indians, we have seen, right? The obesity is also very important factor to contribute into the heart diseases, right? So if we see this, trends, what we are seeing around, if you can see it here, around 115.9 million adults, they have pre-diabetes. Okay, 29.3 million adults, they have diagnosed as a diabetes. 9.7 billion adults, they have undiagnosed diabetes. So these chronic conditions can also be an important cause for heart diseases. Almost 25.5% of the adults have high low density lipoprotein, that is the bad cholesterol in the common language, right? And that can increase your susceptibility or your high risk of having the heart disease. And if you see in US, almost 224.4 per 1 lakh is the ratio for the deaths which are contributing to cardiovascular diseases. So with all these things, what is important is that how that condition is rampantly growing these days and what we need to do for it. Hmm? The cardiovascular disease is now the number one killer of today's world as a, death mortality. Okay, 20.5 million deaths every year are because of cardiovascular. 33% of all the global deaths are because of this. More than 75% of CVD, that is a cardiovascular disease, takes place in low and middle income countries. Okay, and what could be the reason? If you see in this diagram, it is the highest, mortality is happening because of these diseases. And what could be the risk factors for it? It could be blood pressure, which is high. High cholesterol can lead to it. These days, the pollution, which is, very, very intense these days, that could also be a cause. Overweight and obesity, long-term diseases like diabetes or kidney diseases, habits like alcohol, smoking, physical inactivity can also lead to the, see, high risk for cardiovascular diseases, and unhealthy diet. So, it is not just that one fine day you will just get an heart attack. It is an slowly build up situation that happens. And if you take care of your all these matter, your diet, your physical activity, your stress levels, that also is a very important cause. If you take care of it, your sleep, your habits, then there is a good progress and good balance that we can have from our. Okay, so as I said, every 60 seconds someone dies of cardiovascular diseases, right? Almost in 2013, heart disease was the number one cause of death in US. Hmm? So, what is important? Like how we can, when we know all this information, now what we need to do, how we can focus on our heart. And it's not just that, one fine day when we are retired and when we are old age, that time we'll take care of it. It's not the matter that right now, looking at the scenario, right? It's important to start now. It's very important for your children also to be very careful and imbibe a good habits in them. I think that could also, help. And today on this World Heart Day, we can get more conscious and try to bring some changes in us. Okay, and awareness is something very important. So by telling you all these things, it's not just to make you scare or something, but when we have awareness, we'll be able to work on it. Hmm? So, as we little bit about the physiology and anatomy of the heart for people who don't know. Okay, so there are chambers in the heart, as we know. We call them as atria and ventricles. There are some walls. If anybody in your family has a wall disease, so you all must be knowing. And the blood supply to the heart, that is basically through the arteries. That what is the main function of the heart is to pump the oxygen rich blood to the body, and whatever the deoxygenated blood that happens in the body, that is also get uh, is provided to the heart and then to the lungs, and then it gets oxygenated and it returned to the heart and provided to the tissues and organs of the body. Okay, there are arteries which carry the blood away from the heart. So arteries will have the oxygenated blood. Okay, and the veins which are there, they carry your deoxygenated blood. So if you see, arteries will, the blood which is from the artery will be more bright and bright red color, and veins, it will be more of a kind of, not, it's a dark color blood that you will be able to see. Okay, this is more of a structure of the heart, and it's not necessary to go much into details, but heart is the organ where there are a lot of blood supply is there, and this blood supply, how it gets pumped into the heart and away from the heart is something which is very important, and that can be predicted only with the heart health, how strong and how effective your heart is to pump this blood. Okay, about the parameters, let's understand what is the normal blood pressure, because that's something which gives us an idea of this pressure in which the heart is functioning. Okay, so what is the concerning for your alarm for your cardiovascular diseases? So normally we know, generally, our pressure, what is the pressure? There is one high level, that is the upper level, and there is always a lower level. In medical term, it is called systolic, which is an upper number, and a diastolic, which is a lower number, right? So 120 is milligram Hg is the systolic, and less than 80 is the diastolic, is the normal blood pressure. Okay, there are conditions it can get elevated, like in stress, or when we are having any complaint, like when you're not feeling well, constant anxiety, or all these, and there is an elevated pressure which can be for physiological. When I say physiological, means there is some reason for it to happen, or you're doing a lot of physical activity, and if you check the pressure, that can be elevated, 120 to 120, and less than 80. This is a range of elevation which, on the normal circumstances, will come to the your basic level. Okay, when you see sustainability of this blood pressure to around 130 to 139, and the diastolic pressure of 80 to 89, if it's sustained, then it is considered as a stage 1 hypertension, that is a high blood pressure. 140 or higher is stage 2, and diastolic 90 or higher. And the hypersensitive crisis, that is the level of the blood pressure which you need to consult your doctor immediately, which is higher than 180, and the diastolic goes to higher than 120. So these are the level where you have to understand where you need help, when you need to take the medicines, right? And it's very important, it is a sustainability. It's not just the one situation where you are having this kind of a pressure and then you are considered or labeled as a hypertensive, but sustainability of it for long time can give rise to the blood pressure levels. But it is important to not to neglect it, and it is very important if you keep a record of it. Hmm? It's not just that sometimes you're feeling, if there are any symptoms like if you're feeling headaches or if you're feeling any kind of a dizziness or lightheadedness or any kind of a strong emotions, it's important to check your blood pressure and keep a track of it. Okay, because that something is a very very important cause of cardiovascular diseases. Okay, then the another important reason is the cholesterol levels. Most of it, what I see in my practice, many of them they will have the high cholesterol level. It's not that the cholesterol levels will suddenly can give rise to this heart diseases, but if you need to know, right? You need to have that checkup, and you need to be conscious about is what is happening at that particular time. So there is something called a lipid profile, which is a very important uh, diagnostic tool, and it should happen when if you are crossing around 35 years of your age. It's very important that you check at least once in 3 months or once in 6 months this lipid profile. If you are tend to have not healthy habits of eating, or you have a high like heredity of having high cholesterol, or your age your weight is not in the balance, or you have a sedentary lifestyle, it's very important to get checked. Okay, so total cholesterol, that is 240 or higher, is something which is important to be looked for. And then LDL cholesterol, that is 160 or higher. And HDL. HDL, when you say high density lipoprotein, it's a good fat in the common language when you say. So under 40 and under 50 for female, it's important to be looked for. Okay. This, the levels which we are mentioning, it's not just, that you to be taken on the face value. Okay, this is very important to be diagnosed, of course, but you must, consider or consult your doctor for this. Total cholesterol between 200 to 239, they are at a higher risk. So if you see in your reports, it's constantly mentioning these kind of a report, then it is very important that you take. It's not important that you start medicine immediately. If you are say under at risk level, it's not important just to start the medicine immediately, but you can have a you consult your doctor and see if you can do any changes in your diet or if your physical activity which will help you to burn out this kind of a cholesterol. Because in my practice I've seen most of it is generally related to the lifestyle habits that we have and the food that we generally eat, or kind of a life that we generally live. We don't have good sleep and all of that. So that could also be improved and can be taken care of unless we know this, right? So knowing is very important. One fine day, because this might not have any symptoms for you, right? But if you keep a check, it will help you to find out this kind of a condition on the right time. Okay, and generally we say we eat uh, घर का खाना, we don't eat out much, or uh, we have a kind of a good eating pattern, but I have seen still that can also be a reason for cholesterol high, because the kind of oil that we use, or the kind of amount of the oil that we put it in normal sabzi and uh, the dal that we have. Okay, so it's very important to keep a check on it, right? So along with this, there can be other reasons, uh, like particularly the diseases of the heart, like arrhythmias or arteriosclerosis or ischemic heart disease. Ischemic heart disease is nothing but our heart attack. Arteriosclerosis is thickening of your arteries, and arrhythmias is like your heart is beating fast because of some issue in the heart. This could be common condition in the young people, along with the obesity and high cholesterol level and hypertension that we spoke in the past. Okay. So why there is this high blood pressure chances in youth uh, these days? What we have seen is one is of course the stress that the youth that are taking, demands of the finances, demands of the family, demands of their own, to grow in the career or whatever is the reason, but the pressure that they take or the stress that they go through. Okay. Lack of exercise, poor diet can also be a cause for it. And if even if there are no symptoms, oftentimes it happens that symptoms are not there, but making the regular checkups can help us to find out the high blood pressure in youth, which will prevent the long-term complications. Okay, obesity and is risk. Most of it we see either it is an overweight or obese. They will carry less of the oxygen, right? And they are more prone for having long-term diseases, chronic complaint like type 2 diseases. Okay, and which can increase the risk for your heart complaint. So that need to be taken care of. Hmm? And according to the study in American Heart Association, about 20% of children in US have elevated cholesterol level, and which can be a part of their cardiovascular diseases in their life. Why? Because food, which is refined, okay, processed foods, unhealthy fat could be a part of, having either daily of these McDonald's or KFC or burgers or these vada pav and all of that. It tastes good, so and it's very that way it gets marketed also these days, right? On and it creates some excitement in terms of the food and most of us, if we see in India, then most of our celebration, most of our kind of meetings are related to food. And in terms of the children, if we see these days, they also kind of started going out and exploring new of a restaurant, or even if they go for a movie, having those kind of a thing can also increase the uh, special level in the cholesterol and can get into the high risk of cardiovascular diseases. So it's very important that we look at it and we work on it. Sugar drinks, all the cookies, all the chips, snacks, they all are related to increase this cholesterol levels. This is something I think which is very very common these days. Most of the houses we will see that, right, these days, with the screen time, long hours, less of the physical exercise, stress eating, then kind of having things which are like very exciting, and French fries, which is the common thing for young people to have these days. And I think this picture can help you visualize and can understand that how it is being a part of the your cardiac imbalancing health, right? We have seen that arrhythmias also happen in young people, okay, which can be an underlying issue with hereditary or stress related. Hmm? So monitoring symptoms like palpitation, dizziness is also very important to be taken care of. And it's important that there is a space, and there is an uh, in a space in the family or understanding where you need to take help for these conditions, because sometimes we kind of ignore or we kind of don't give an importance to it because we thought, oh, it is just related to anxiety or kind of a stress, or it's very familiar thing these days. But it should not be ignored and undiagnosed. That's something very, very important. Then heart attack, that ischemic heart disease, where the blood supply to the heart decreases. And the first symptom that comes with this complaint is the chest pain. Okay. And this chest pain generally it happens, starts at the center of your chest, then generally go to the side where the heart is placed on the left hand side. Hmm. So those symptoms need to be also checked for. And atherosclerosis. Atherosclerosis is deposition of some plaques. Okay, whether it is fat gets deposited or thickening of your blood vessel, and because of that, the blood doesn't pass through it in a normal smooth flow doesn't happen. So there is the narrowing of this artery, and once the arteries become narrow, so what happens is the blood flows with the pressure, right? Which creates a pressure backside of the heart, right? And that leads to the many complaints of complications of heart attacks and strokes, kind of. So this can be a part of also your heart health. And these days it is becoming very, very common, as I said. Hmm? Impact of smoking and alcohol. It has lot impact on your heart health. It's the most important, I would say. And why? Because this is the most common thing and a trend that these days get followed. Sometimes people smoke just for maybe fun, or just for maybe a social pressure, or sometimes because of the bad uh, habits, or being in bad people's company, or sometimes stress, or these days the exploration of the young children, or in the adults also, it's more, right? And the high demanding jobs, high increase needs for our finances, or increase kind of demands from the family, or in whatever reason, if the stress is created, the most important thing what people generally take help of is either smoking or alcohol, because it soothes your kind of stress, and it relieves your pressure. And then we don't even come to know when we become habituated to it, or when we become dependent on it, unless we are very aware of it, right? So it's very important we take a note of what how much amount of the smoke or the alcohol that we are dependent on. We already taking lot of smoke. There is lot of air pollution these days happening, right? And I think if we become more aware about this, it would definitely help you to maintain a good heart. Hmm? Even if somebody who is already a chain smoker, I would say. So, the experiences which he had gone through in the past, and for whatever reason that he is addicted to it, but at this level, if we make maybe your family or your whoever friend, if you make them aware of this, I think the step can be taken to get better heart health. Hmm? And there are possibilities. So we have kind of uh, patients who come to us for because they are addicted. So sometimes it's not, the things are not in your hand, but in our practice, what I've seen, homeopathy along with the counseling has really helped our patients to get away from these kind of dependency habits. Yeah. Generally what happens in, it's kind of a, why it is important, because excessive intake can elevate the blood pressure, it can affect your liver, it can affect your entire metabolism. Okay, the toxins that gets released in the body. So if you make a wise choice and educate yourself of it, I think that will be very important to prevent the harm. Hmm? And now this hidden connection, stress, which is an all-time favorite these days. Every single individual go through it, even children go through it, and everybody these days, whatever we see, they are stressed or whatever is the minute reason, you know, it can affect your heart. And it is not visible unless you have symptoms, but the chronic stress is supposed to affect your heart at a very, very deeper level. And the studies also shows that. Hmm? So it can lead to chronic blood pressure increase, and significantly it can increase the risk of your heart diseases. Very important. How to tackle the stress. And again, for the stress, it's important how you can, you know, get better help to alleviate this stress in a good way. How you can channelize your energy of this stress in a better. So of course, homeopathy help for it too. Physical activity help. Mental activities like meditation, breathing activities, something very important that you can help you to get better in this stress. Yeah, so almost 70% of teens they report feeling stressed about school, their social issues, and future uncertainties, which can also affect the heart. Okay, and then what happens with this kind of a stress, your coping mechanism is not good, and which get added with this poor eating habits and sedentary behavior. So it increases the risk. Okay. So why even fit people experience the heart issues? No, we see in gym they were exercising, they got heart attack, or sometimes you are having good lifestyle, and that time also it happens. Right? Why? Because there can be one thing very important: genetic predisposition is there. That in your family it is there, and it gets into it, or certain sudden situation like sudden exertion, intense physical activity can lead to it, or intense exercises like the long running can also affect your heart in general. So it's very important where you consider your heart in whatever activities also that you are doing. Hmm? So as I said, running is it good or a bad for your heart? Okay, so of course it helps to increase your metabolism. It improves your cardiovascular fitness. It also reduces the heart attack risk and all. But too much, anything which is an out of balance, overdoing it can affect your heart. Why? Because it can create some plaques or scarring and inflammation of the heart, which we call runner's cardiomyopathy, right? So for them also it is need to be taken care of going out of the balance, right? Or just the running, like if you're running just for 41 kilometers every month, or every 2 3 months, and how you're not keeping a track of it, what's happening inside you, then it's very important. So regular checkups can be done, and you can balance that with your some aerobic activity where there are a lot of oxygen can go inside your body. Or 1 or 2 days you can have to have more of a relaxing exercise which can help you to calm your mind and provide more oxygen to your body, like yoga, swimming, and walking, right? So that's something is also need to be taken care of. Hmm? So what we can do to all this which I said, and certain things are which are undeniable, because stress will always going to be there with us. The lifestyle that we have is going to be there. So what we can do for it, that's very important. Effective stress management, how we can do. So first of all, the awareness of that, how my stress can affect. That's important. Second thing, the physical activity regularly, if you do it, it can channelize your mental activity. So whatever happens in your body and your mind, they are not disconnected. Whatever you feel inside your head will show up on your body, and whatever you do for your body will also help you at your mental level. So if you exercise regularly, there will be, kind of a channelization of these energy that will happen. So if you see, you will feel more fresh, less of the thoughts will be there. Your coping mechanism of the stress would also improve, and indirectly it will also improve your physical health in terms of your heart, in terms of your weight, in terms of your body metabolism. So it is neither in isolation. So if you are doing say any exercise, it's not just for your body, but it also helps at your mind level. Which helps if you see, if you breathe fast, like if you are angry, you will definitely like breathe fast and your breathing become very shallow, and you'll gasp for a breath. But if you are very calm, relaxing, and if you're doing yoga or something, you will be so calm and peaceful, and the breath will tell you that what kind of a mind that you have. And with this physical exercise, you'll be able to maintain that for a longer time, right? So that's very important. Then some mindfulness practice, like taking care of your emotional state. This is important. So for that, if you do meditation, if you improve your sleep, if you improve your relationship, that can also help, right? Any kind of a breathing techniques will also help you. Any kind of awareness technique which will help you to calm your mind will be helpful to reduce your stress. Hmm? In time management, no, these days what we have less is time is the most important thing these days, more than anything, right? So if you have, a busy schedule, or you're overwhelmed by it, and chaotically, you want to do multiple things at a time. You have to, in Mumbai, you have to be in Mumbai traffic, you have to reach somewhere. It's kind of a stress, no, to us. So if you manage that, can also lead to a better emotional as well as the mental. And whenever you feel, you must take the help or support of the required resources. So definitely, if you need more of emotional and kind of a outburst of your emotions, it is important if you can take help of the talking to your friend or talking to your counselor, which can help you to release your emotional mood. You can help, if you feel good doing things which you really like, spending time with the family or friends, or who can nurture your emotions will help. Then also taking help of any medicines if required. If you diagnose with say blood pressure or cholesterol, high cholesterol, or if you have complaints like um, bulimia, we generally say eating disorder kind of a thing, you can take help of the medicine. If you have any habits, you can take a support, and don't shy out of it. Whatever is happening, it's important to be acknowledged about it, and then taking some measures to get it better. So I think that can also help. As per my understanding, how my life unfolded, I think yoga had helped me a lot, a lot. I owe so much for this science, and I've seen it is affecting it in every way, whether it is bursting your stress, whether it to bring your body and mind together, whether it is your hormonal complaints, or whether it is your, just to make yourself rejuvenated. It has helped me in all my aspects, and I've seen that happening with my patients also, because in our clinic we generally run that, and we have yoga classes which help our patients to get better in terms of the complaints that they have, along with our homeopathy medicine. So it helps the maintaining your flexibility, strength of the muscles, relieve your stress, and more balanced and healthier organs, and specifically the heart. Okay, and It's not just the bodily phenomenon. It's yoga means like you're bringing your body and mind together. So it's a union of it. So when you follow this, there would be not just the physical benefit, but also the benefits at the level of mind will be there. So sustainability and regularity in the anything that you do, where be it yoga, for me it has really helped. But if something like swimming helps you, something like say walking help you, something like any cardio activities help you, like zumba or dance, or any kind of physical activity which you relate, can really be helpful for maintaining your health. Hmm? And some poses which I have experienced and I've seen in my patient to get your better health are this downward dog, warrior two pose, which you can see in the picture, the child pose. Maybe you can find it out on the Google, and or maybe you can subscribe to our YouTube channel where all these videos are there. Corpus pose, that is the relaxation, shavasana. It's very important if you need to get the better heart health. Setu Bandhasan, then Dhanurasana, Janu Shirshasana, all they help you to get your heart better. Also pranayama is very important. If you do say just 5 minutes, okay, in your day-to-day life for pranayama, half an hour for any kind of exercise, I think that is the promise that you can do today at this World Heart Day to make it, kind of a good start. So that will also very helpful. Hmm? And whenever you're following yoga, I would also say that you know do it with teachers before, rather than just starting. If you have any condition, of course you must take a help of the teacher. But if you don't have any complaint, but still if you learn from teachers how to do that pose, that is also very important. And according to me, for yoga, it's not just that how many asanas you do in 1 hour class. It's not important, but what you feel and what is the experience of that asana when you're doing it. That is something very important, and you focus on it. Then implementing the healthy, kind of choices, like eating habits. What kind of meals that you take, a balanced food with good of nutrients will really help you. If you see, if you consider your plate, okay, what is that plate should fulfill of? So there is carbohydrate, that is the sugar that we take, and there are proteins that we take, right? Then there are some fat that we take, lipids. They are important, right? Then there are fibers which are there, very important, which needs to be there in our meal. So it has to be a balanced diet. And throughout the day, the balance you can maintain. If there are possibilities that lunch is affected or dinner is affected, but you try to see that into your entire day how you're balancing and having all these kinds of nutrients and elements of the nutrients in your food. Okay, so fruits, nuts, yogurt, make them a part of your regular diet, which is something very important. Drinking lots of water can help you to feel full. The water is required for all the activities in your body related to your food. So that's also very important. Herbal teas. There, if you try to take that, it will be very helpful. Then plant-based diet, I've seen that it's very helpful these days. Anything. If you go vegan, that will be best for your health, because animal products generally have more of a fattening elements which can affect your heart. So all the green veggies, anything which are related to plant-based diet has really helped. And I've seen in the cases also with patients who are having these complaints, they get better if you change your diet from animal product to the plant-based. And you can start, slow. It's not that today, if you decide and just do it every, like just follow it. You have to follow it by hook and crook. No, you can start with the slow and steady, once or one step at a time. That you can decide. Say, in this week I will have two kind of one fruit in a day. I will have maybe in the next 2 weeks I will have two portions of fruits in a day, or I'll have more veggies, one whole bowl of a salad I will have for the entire 1 week or 2 week. And then slowly you start increasing those kind of challenges to yourself depending on your body. Or also you can also consult somebody who has a good knowledge of nutrition, and they are expert in it, which will help you to get these things better for you. So that also is very important aspect. And then impact of meat and processed food on the heart, very important because they are high in saturated fat, so it can lead to elevated cholesterol level. Then it can build up the plaques inside, so it can also help to increase the blood pressure levels. Then they also contain preservative nitrates, which can also cause some health problems. Okay. Then high proteins. Generally now our whole focus is changed. Now everybody is thinking of how much protein I'm taking in the diet, and they're taking most of our meals are based on protein. Or people follow just like that. They follow as a fashion trend for keto diet, where the proteins are provided. But what is important is how much protein is also required for your body and how much it can digest, and you know kidney can take the pressure of it. But if you over bombard it, then it can also cause some problematic to your kidney diseases. Okay. Then generally meat they lack dietary fibers, so that can also help your affect your digestion. Okay. And sometimes it is contaminated with bacteria or parasites, so that can also include some foodborne diseases if it is not cooked or handled well. So all these things could be avoided if you shift your focus from animal product to the plant-based product. Hmm? Then gluten free. Generally, what I've seen in the practice, many of our patients with having lot of acidity, heartburn, bloating, and those kind of a lingering complaint, they feel better if we ask them to take less of it. And in most of our Indian traditions, we have wheat, in long term that we use, and most of our food also we take that. But if we replace that, I think that really helped my patients for digestion and acidity and all the issues. And overall health also it will kind of increase your digestion. If you want to take a wheat, less processed wheat, like it is called Emma wheat or a Khapli wheat, what we call. It's very good if you want to replace your normal wheat with this. Hmm? And gluten-free diet would really help to your heart complaints also. Meditation, Zen counseling, homeopathy, they all together can help you much better level to work on your heart. Hmm? Counseling, we generally follow this Zen counseling where it is mainly focuses on your mindfulness and deep relaxation, which can help to your reducing your stress and your support. Homeopathy, you've seen the remedies do wonders, to support your cardiovascular function, regulating your cholesterol and maintaining the blood pressure. Hmm? Homeopathy, I think I can maybe, share some my experiences because it helps your cardiovascular health, cholesterol regulation, because it's not just a specific medicine that we are giving. Okay, you have a cardiovascular disease, so we are giving you medicine for that. Of course, if you have that, we'll work on it, but it's a medicine for your system. So it helps your metabolism, it helps to maintain your blood pressure, it helps to reduce your stress because it also acts at a holistic level and not just the level of your body. So that's very important. Wanted to share some cases that one a case of hypertension. Okay, so the guy who was around 40-year-old, and it's very common scenario where long working hours with high pressure and corporate life and a lot of struggles between the family and demands of the family and the corporate life and everything, and he was in between affected a lot. Hmm. And there were symptoms related to the, of course, blood pressure and hypertension at the body level, but at the mentally also it was lot of outbursts in terms of emotions, irritability, anger, and all of that. And it used to affect his life, physical life, like bodily, as well as family life was also affected. And when he came to us, along with homeopathy, we had helped him with yoga for his meditation and kind of a breathing technique which helped him a lot in the long time. And almost he was not on any medication, he was not taking any hypertensive, but he still did better and he was with us for almost 3 years with all the blood pressure at the normal level. And still, when we are in touch with him, his blood pressure is normal. And all the symptoms related to it, like a headaches and dizziness, they improve. So homeopathy helps at a very deeper level in terms of this complaint. Another case of the ischemic heart disease and high cholesterol, and he was already diagnosed as IHD, and he, along with the whatever the medicine that he was taking, but he wanted to start homeopathy so that we work on his kind of health of the heart. And same with the homeopathic medicines, with kind of exercise and proper diet, because in already complained with ischemic heart disease, they need proper monitoring. So this proper monitoring of his heart health, his lipid levels, he did really well with homeopathy, and his complaint really, really, get better. And his way of looking at things in terms of his health, his terms of his work, they also get better, right? So that is how it has a lot for patients. And there are many cases, such cases which I have observed, and that is how I wanted to share this with all of you about this. So what is our takeaway today is the first foremost thing is to be aware of it, to understand the importance of it, and keep a track of it if there is anything that is happening. As a precautionary level, we can do fresh in terms of changes in our, you know, dietary habits, taking fruit, veggies, whole grains in our diet, 30 minutes of exercise. We can give at least 30 minutes to ourselves if we are, if we can work for say almost 20 hours, we can give at least 30 minutes to us. So you make that, promise to yourself that I will do that for sure. Also look out for your symptoms if there are any and take a help of it. Help of any kind of support or a medical fee if required. Lot of drinking lot of water throughout the day. Hydration is the most important. Good sleep, around 7 to 9 hours. And if you see sleep in between the time of, say, if you sleep early, say around 10 o'clock or 10:30 or something, till 2 o'clock or that kind of around 1 ish, that kind of a sleep which is there, 1 to 2 between, that sleep is the deep sleep. So if you miss that time, whatever time that you sleep after say 1 o'clock, 2 o'clock, and you sleep till late, say 7 o'clock, 8 o'clock, you will still not feel fresh. So if you follow this kind of a early sleeping pattern, you would really, really rejuvenate and feel much better in terms of your heart. Balanced diet, exercise, emotionally, your challenges, our habits. If you keep in control the consumption of alcohol or smoking or anything, that can also help, right? So all these are a precautionary aspect that we have seen. Now what's important uh, aspect is what is the first aid if you have seeing any patient or anybody in your family or anybody in your surrounding having kind of a intense attack or something, then what you can do as whatever as a layman that you can do, right? Of course, the emergency services to be called upon, your doctor should be spoken to, or hospitalization is something very very important. There is no replacement for that at all. This is something at the very very basic level when all these services are coming into your health and you have a time. Okay, first is very important to diagnose. So if chest pain, don't ignore that. Take a important and understand the severity and intensity. If there is a pain, make them relax, make them sit, and lie down. Give them good air, airy space. That would be the crowd should not be around. That can be taken care of. Then discount if there is a possibility, then ask what is happening to them. If there is a chest pain, if there is any discomfort in your arms or any jaw, or there is a shortness of breath, observe that. Hmm? And CPR, that is cardiopulmonary resuscitation, that is reviving your heart. Okay, back. How you can do that and when you can do. It's very important and very very sensitive thing to do, but you can always opt for a help for it. But it's something which you can also try at your level. Hmm? If somebody is going unconscious and unresponsive before the emergency services come, you can help doing that. Okay, the first thing that you will do is a call emergency, and then whatever vitals that you can check. Okay, whether it is a heart rate or blood pressure, do that. Then check breathing, whether that person is breathing or not. Hmm? And then one is providing, keep the head tilted and chin is lifted, and then give rescue breaths. Okay, with your breath you can give that to them. And then you can perform CPR, or how you can perform CPR, that I'll tell you. But turning on one side will also help to provide less work on the heart, and of course the hospitalization will be something very right. CPR, that is a cardiopulmonary resuscitation. If you can see it in the steps, the patient is lying down. Okay, you are sitting here, the person who is giving the CPR. You see the movement of the heart. Okay, it is the clasp hand, and that is to be kept on your breastbone or the chest bone, like this. It is in center of your chest here, and that will be at the end of your chest. So it starts from here. So this is our clavicle. This is collarbone, what we call. From here it starts up to the middle of your chest. The end part of it here, if you can see in the third diagram, at that level you start giving pressure. The pressure should be in the form of your stand. You're not putting your pressure on the patient. Okay, you're just putting your hand pressure on the chest. Okay, so that how it will be happen, because it has to be your shoulders also need to be straight, right? And you put some pressure on it in a such a way so that the elbows they go down on your chest, and when they come up, your entire chest revolves back. Okay, right? And this compression should be little fast and pressure wise. Okay, which will help to increase the blood supply to the heart. This is at a very basic level, initial level. If you are not feeling confident, you must not do. Okay, but this is something can be done, and we can take care of the patient before the emergency services can come. Hmm? And taking them, or at least fasten it to take them to the hospital is something which is very important, right? Symptoms should not be neglected, and if it is anxiety, even if it is kind of a panic, making them relax, staying calm will also kind of help. So I think this is something which I wanted to share with all of you, and I think it will really help if you follow these things for you, for your family, or you can educate your surroundings. I think that would also be helpful. Hmm? If anybody has any questions, then maybe they can ask. Okay. Any feedback? Anything which you really liked, or anything which you will take away as a from this workshop? If you want to mention, Lakshmi, Anjana. Okay, I think no response. So thank you so much. And if you have any question, you can write to us. Or if you need any help, we are here to help in terms of homeopathy for your diet, yoga, counseling, meditation, everything. And reach out to us. We'll see what best personalized program that we can create for us. Okay, thank you so much.